You are Dr.
Maryjo Prince-Paul. I'm from Case Western Reserve University, and I'm an assistant professor there and also a postdoc fellow through our National Cancer Institute Case Comprehensive Cancer Center.
Now, why did you do this study?
Well, I've been an oncology palliative care nurse practitioner for over 10 years, and so I've understood the value and the fundamental principles behind integrating palliative care into community oncology practices and advanced cancer. So that's exactly what we did. We needed to systematically measure if adding an advanced practice nurse with a palliative care clinical expertise into this community practice would change patient outcomes.
And did you change patient outcomes?
Well, I think what I first have to say cautiously is it was a pilot study. So we used pilot study data in order to inform the next step in intervention studies. So with that being said, our two major findings were that if you were in the palliative care group, you were 5 times less likely to be hospitalized and 15 times less likely to die if you had palliative care interventions within your plan of care.
What were these interventions?
Well, what the palliative care advanced practice nurse brings to the patient and family with advanced cancer is the ability to spend a lot more time than the physician does in the practice, and specifically speaking to symptom management, looking at pain, depression, nausea, vomiting, clear symptom management, as well as advanced care planning. So really focusing on what is it that are the patient family goals of care. Is it that they want to see their granddaughter be born, or do they want to take a last trip to Florida? And so really trying to incorporate their goals of care within the medical model. So advanced care planning, symptom management, and really overseeing from a holistic point of view the biopsychosocial, spiritual needs of the patient and family.
So patients actually lived longer who received this palliative care intervention?
Exactly. So it's it was statistically significant with a very small sample size. So we have to say these data with caution. But what it did do is it allowed us to see importance in going to the next step, which is feasibility and clinical utility, and organizing it out into a multi-site study where we bring in different types of community oncology settings with different demographics and geographical characteristics.
Just one other question. Are you going to carry on this further? Are you going to go further with this work? You did a pilot study. Are you going to go?
Right. Just the multi-site study, hopefully being able to be funded, and that's a key thing, being able to get funding, as well as being able to replicate the study with other advanced practice nurses who have specialization in palliative care.